So, so let's get started. To begin, I would like to provide a quick background on each of the organizations we have joining us on today's panel. So, Generation Up is a California-based nationwide student-led social justice organization and student activist coalition that strives to advocate for education through the power of youth voices. Right? Teens to Vaccine, as mentioned, is a youth-led organization dedicated to empowering teens to educate themselves, their families, and their communities on the life-saving power of vaccines. The Youth Leadership Institute's mission is to build communities where young people and their adult allies come together to create positive social change, and the immunization branch of the California Department of Health provides leadership and support to public and private sector efforts to protect the population against vaccine-preventable diseases. The Vaccinate All 58 campaign, now housed under the Office of Community Partnerships and Strategic Communications, is California's statewide campaign for a safe, fair, and equitable COVID-19 vaccine for all 58 counties in the state. And now on to today's agenda. So we will begin with an event overview, then followed by a COVID-19 vaccine update from Dr. Jenny Chen, and then we will have representatives from the Vaccinate 58 campaign having misinformation overview, followed by a youth panel discussion, a Q&A session, and closing remarks and the call to action. So here's a little introduction for Dr. Jenny Chen. Dr. Chen received her medical degree from Tufts University in Boston, Massachusetts, and her master's in public health from the University of Chicago at Illinois. She's board certified in internal medicine and in pediatrics and has more than 20 years of clinical experience before recently completing a residency in preventative medicine. She is a public health medical officer in CDPH's immunization branch and has been working on the MPX and COVID-19 vaccine responses. We are super excited and very thankful for Dr. Chen to be here with us today. Dr. Chen, the floor is yours.
Great, thank you so much. Next slide, please. So the first slide is just going over the California statewide, the update of COVID-19 currently. On the upper left, you'll see that the total amount of vaccines administered across California is almost 86 million. That's including all primary series and boosters. Currently, the total number of reported COVID-19 cases in the state of California is over 10 million, and it's averaging about over 5,000 a day. This is number of positive cases or results. For those who are ages 12 to 17, there's been over 2 million who've received their primary series, and that's about 67% of all of the population of 12 to 17-year-olds who have received their vaccine primary series. And then of those who've received primary series and are also their booster vaccine, that's those who've completed that whole series between the ages of 12 and 17, that's not quite a million, which is about almost 41%. Okay, next slide. So as you may have heard, there is an updated booster, and what this updated booster has, it has two of the variants in one shot. And so it provides immunity against the original strain and the newer Omicron variants. And so what this new updated vaccine and booster is hoping to do, and seems to be, as preliminary studies have shown, is that it's broadening the coverage of the types or the variants of COVID-19 viruses, so that as new variants keep emerging, we are anticipating that the booster dose will protect us from the current strains and the upcoming strains. Next slide. So when are you supposed to get your updated boosters? So anyone who's 5 years old or older, who has had their primary series, they can get their updated booster vaccine. And that's 2 months after the last dose that you receive. If you've gotten the infection, COVID, if you test positive for COVID-19, you can still get your vaccines, even, whether it's primary series or a booster, you can get the vaccine, basically as soon as you can come out of isolation or quarantine. So usually that's about 10 days, but you can decide if you want to delay up to about 3 months. The reason behind that is thinking that you have some immunity from your recent infection, but as we have heard in the studies, your immunity can wane over time. So it's important to get your vaccine anyways. Okay, next slide. So there's been lots of studies about the vaccine safety. It's been out for almost 2 years now. There is a national vaccine adverse event reporting website through the CDC. So this website collects data and has published several studies showing that the vaccines are safe and that the side effects are minimal. So it's important to go ahead and get your vaccine. Anyone who's 6 months or older can get a COVID vaccine. We're also concerned because of COVID infections that some children may be behind on even their routine vaccines for things like diseases like measles and tetanus. And so if you can, it's a good idea to get your COVID vaccine with your other routine vaccines like the flu. So flu rates are going up. So trying to get both at the same time would be good. Next slide. So COVID infections in children and teens. So COVID-19 can cause infection in all ages. And in all ages, you can have complications and be very sick and sometimes need to have treatment in a hospital. And the vaccines have been shown to lower the risk of ending up in the hospital or having a really bad case of infection and even preventing death as well. There's a condition called multisystem inflammatory syndrome in children. This also causes, it's a severe complication of COVID infection, and the vaccines also prevent this for kids getting this syndrome. The reactions are very mild to moderate. That the most common ones are pain in the injection site and feeling tired. And these usually are temporary and resolve pretty quickly after 1 to 3 days. So far, over 200 million people, including 200 million children, have received the vaccine. That's nationwide. Next slide. So how can you get your vaccine? The slide is showing that there's 3 options. You can go to your family medical provider, your pediatrician, the community clinic. Many have the vaccine and you can get your vaccine there. You can, if your provider doesn't have the vaccine, you can visit our website, our state website, myturn.ca.gov, and that website will direct you to locations close to you that have vaccine available. And many pharmacies, local pharmacies, also carry the vaccine as well. And if you're older than 3 years old, the pharmacy can administer the vaccine for you. Next slide. So I'm going to introduce Maddie Clapp. She's from our Vaccinate All 58, or VA 58, and she's an expert on how to identify and address misinformation. So she's a member of our California Department of Public Health campaign. The campaign is, as previously described, trying to provide vaccine to all 58 counties and jurisdictions and address equitable access to the vaccine. And she specializes in COVID-19 vaccine misinformation and shares strategies for how partners and the public can mitigate the impact. And also improving our efforts to get more Californians vaccinated. Passing it to you, Chen.
Thank you, Dr. Chen. Hi, everyone. My name is Maddie Clapp, and as Dr. Chen mentioned, I'm a part of the Vaccinate All 58 campaign. Today, I'll provide an overview on the topic of misinformation, specifically as it relates to the COVID-19 vaccines, as well as ways to identify it and respond to it if and when you come across it. I'm sure you all do. So first, let's go through a few definitions. To effectively combat misinformation, you have to know what you're looking for, right? So misinformation refers to false or misleading information that is shared without the intent to cause harm, confuse, or trick an audience. We have likely all come across misinformation, and in fact, we're probably all guilty of sharing it at one point or another. For example, have you ever shared a news story in a family group chat after just reading the headline or without checking the sources? And if so, it's possible that you have shared misinformation. Disinformation, on the other hand, is false or misleading information that's shared intentionally to harm or manipulate others. And this can look like a specific group or person sharing misinformation to cause confusion, to discredit someone, or even boost their own bottom line. It really all comes down to intent here. And then lastly, we have malinformation, which is a little bit different. It's information that is technically true, but it's taken out of context to which it has a new meaning. It's more of a technical term, not often used in normal conversation, so it may be new to most of you here on the call. We do tend to see a lot of malinformation when it comes to the COVID-19 pandemic and the vaccines. For example, someone may share a single anecdote about an adverse reaction to the vaccine as evidence that the vaccines are unsafe. But we know that context is important here. We know millions of people have been vaccinated safely, and by focusing on one instance instead of the bigger picture, malinformation is able to skew the truth. That said, today we'll just be using misinformation as an umbrella term to encompass all three of these terms. So with that, we can take a look at how and why misinformation spreads on the next slide. Great, so misinformation can spread in a number of ways. For example, through private messaging, social media, word of mouth, mainstream and alternative news, blogs, message boards, etc. And when it comes to why misinformation spreads, as I mentioned, misinformation is usually shared unintentionally. In a lot of cases, it's shared out of genuine curiosity or concern. And social media and technology make it easier than ever to share things, regardless of if the information is good, bad, factual, or misleading. Unfortunately, sometimes misinformation can be used as a tool to help individuals get what they want for personal or political gain. And this is really when disinformation or malinformation come into play. There are also emotional, social, psychological forces that make people more prone to sharing and believing misinformation. Research actually shows that people who get positive feedback for posting inflammatory or false statements become much more likely to do that in the future. Lastly, some people may not have access to or knowledge about trusted resources, and they could be referencing untrustworthy sources without even knowing. So with that, let's take a look at some potential indicators. So on this slide, we have a few signs that for things to look out for that you may have encountered misinformation. The first indicator that you all should consider is if the information aligns with authoritative sources on the subject. Next, be sure to look out for claims that have been exaggerated or blown out of proportion or conspiracies that have no supporting data. Emotional triggers are another telltale sign of misinformation. As we talked about, misinformation tends to evoke emotions. So you want to look out for information that immediately brings out feelings like fear, anger, sadness, etc. Another indicator is whether the person that you're speaking with refuses to consider the information that's presented to them. This can be a sign that the person has been exposed to misinformation and that it's stuck. And lastly, misinformation tends to appear when there is already confusion or information gaps around certain topics. Therefore, it's important to share out what we do know on the subject and be transparent when more information is needed or if we're unsure. It's also important to continue to stay up to date on the latest information from trusted sources to help answer questions about these topics when they come up. So next slide, please. Okay, so you've learned what misinformation is, how and why it spreads, and what to look out for to spot it. So, what can we do about it if we encounter it? So here are some quick do's and don'ts for responding to misinformation. First step, be careful not to reshare misinformation. And this is certainly easier said than done. But to avoid this, be sure to share accurate, clear, easy to find information directly from trusted sources. Next, you really want your message to resonate with the person that you're speaking with. So avoid using overly scientific or complicated language that someone may not understand. Instead, help them navigate through the scientific subjects using short, simple, and easy to understand language. And that doesn't mean speaking down to anyone, but rather, using language that will connect with your audience and make your messaging clear and memorable. Next, attitude is really important as well. So remember that it's really easy to be influenced by misinformation. So be careful, not to come across dismissive, frustrated, or impatient, but instead be empathetic and understanding and try to really understand where they're coming from and why they may have been swayed by the misinformation in the first place. Similarly, be careful not to use scare tactics or negative language. An example of this could be telling someone, by not getting the vaccine, you're guaranteed to end up in the hospital. So remember that misinformation is often tied to emotion. So you want to remain neutral and share out the facts rather than bringing even more negative emotions to the situation. Also, people tend to listen more to those that they respect or trust. So if you're having a hard time connecting or reaching someone, it could be helpful to communicate through trusted messengers. And a trusted messenger could be someone that's well respected within a community, whether that's faith-based leader, a doctor, pediatrician, etc. But I also really want to encourage you all to be empowered and use your standing in the community to share out your own positive vaccination experiences paired with trusted resources. We know that misinformation spreads far and wide across many different channels. So in order to effectively counter the volume of misinformation, we have to flood the space with trusted information about the COVID-19 vaccines on all available channels and mediums. So that means sharing information across social media, private messaging groups, you name it. And then lastly, don't go at it alone and don't give up. People need to hear a message several times before it sticks. So don't think that a single interaction will change someone's mind. At the end of the day, we know we can't force anyone to do anything, but we can empower people to make their own decisions based on trusted information from authoritative sources. Remember to be persistent and share take-home resources so people can think about the vaccines, they can reach back out if they have questions, and ultimately they'll make the decision when the time is right for them. So that is it from me today. Thank you all for your time. With that, I will pass it over to Arin for the youth panel.
Thank you so much to everyone from the Vaccinate 58 All 58 campaign and Dr. Chen for that wonderful presentation. So now I would like to open up the youth panel. I would like to start. So every person on the youth panel is going to give it a brief introduction about themselves and answer the following question. Why are you so passionate about being here today? So we'll start off with Sanvi. Sanvi, the floor is yours.
Hi everyone, my name is Sanvi. I use she, her pronouns, and I'm a freshman at UC Berkeley working towards a double major in legal studies and computer science. I'm really involved in the student welfare space as the Chief Partnerships Officer for GENup, which Arin talked about earlier, having advocated for public health legislation. I strongly believe in empowering young people with the ability to get involved in their own healthcare, including preventative treatments such as vaccines, which is why I'm really excited to talk to you all today about this subject. And I'll pass it on to one of my fellow student panelists, Arhan.
Hello, everybody. My name is Arhan. I'm a high school senior from San Francisco. I've worked on climate action advocacy and more recently worked with a group of teens in public health advocacy pertaining to vaccine and vaccine access and vaccine education. I'm here because so many people in my community have struggled with gaining vaccine access or even with vaccine misinformation. That's why I think this topic is so important. And I'll pass the mic to Ashens.
Hi all, my name is Ashens. My pronouns are he, him, and I'm 18. I go to Fresno City College and I'm working on my anthropology degree. I'm here today because I come from a vaccine hesitant family, and at the time of the release of the vaccine, I was only 16 and didn't really have a choice on whether or not I could get it. And because of this, I had to take the situation to my own hands, went behind the backs of my family and got vaccinated myself. And because of the situation, I now advocate for the rights of young people to have medical autonomy over themselves. We as young people deserve to have a choice in our health. And I'll pass it to Kiara.
Hello, everyone. I'm Kiara. I'm 16 years old and I go to Edison High School. I love to write and listen to music. I've been involved with advocacy work for YLI for almost 3 years now. And I'm passionate about being on this panel here today because some of the members of my family are also very vaccine hesitant because of their fears, and those fears are brought on by misconceptions. While those fears are very real to my family members, I also have a lot to consider as someone who is at a higher risk for COVID-19. So education around the vaccine is very important to me, in hopes that people like my family will become less anxious about getting vaccinated, while also protecting people like me. And with that, I will pass it off to Ani.
Hi, my name is Ani Juglassian. I'm a senior from Los Angeles, California. I became a public health activist after my mom refused to let me get the COVID vaccine. I lost my job and being able to play my favorite sport. I started advocating for other students with vaccine hesitant parents, and I'm extremely passionate to be here today.
Wonderful. Now I think we're going to start our youth panel discussion. Arin?
All right, yeah, so thank you everyone for your wonderful introductions, and we will start off with some of the questions. So, Arhan and Kira, what misinformation have you most commonly heard when having conversations about the COVID-19 vaccine?
Yeah, so there are two main ones that I've heard in my community. The first being this idea of herd immunity, which is essentially just understanding that vaccines aren't really necessary because others in the surrounding community are getting vaccinated. Another myth that I see or another point of misinformation that I've heard that's pretty common is this idea of natural immunity being more effective than vaccine immunity. And I'll pass it to Kira.
Yeah, so especially with my family, I've heard a lot of misconceptions, some of them being that getting vaccinated causes infertility, that the vaccine can make you sick, just the healthcare industry faking COVID to make money, things like that. I've heard from my family, I've heard online, they're very common, but they are misconceptions. So,
All right, thank you, Arhan and Kira. That was very insightful. And Ani, how have you dealt with vaccine hesitant family members?
It's really hard to deal with vaccine hesitant family because sometimes you can be put into a really dangerous situation. As someone who has had, parents who are vaccine hesitant alongside, my grandma and uncle, having just so many people who are against you and think very differently from what you do can feel really difficult. And what I think is most important is always to have open communication and make sure that you're doing it in a safe way where you're not putting yourself in any harm's way or other people in harm's way, and always trying to understand other people. I think oftentimes we forget that we just brush off other people's worries, like we brush off our parents' worries and be like, well, mom, you're delusional or this, that, but actually listening to what your parents are worried about so that your parents can also listen to what you're worried about or what the other people's worried about is really important.
All right, thank you, Ani. And Ashton, did you face any kind of barriers while getting the vaccine?
Yeah, definitely. The biggest barrier I probably faced was actually being able to get the vaccine. As I said before, I was only 16 at the time of the release of the vaccine. And with my mom being vaccine hesitant, I didn't have a choice. So my barrier was being 16, not having medical autonomy over my own body. And this is something I'm not alone with, as we've seen. And the purpose of me saying this isn't to shame my mom, to shame anybody. I understand the history that we see, especially in like the Latino community, in my community, here in America. I know how intimidating vaccines can be, but this is something that we need to normalize in our communities. We deserve to be healthy and we deserve to have accessibility. Thank you.
All right, thank you, Ashton. And Sanvi, where can young people access reliable resources about the COVID-19 vaccines, and how can they discern between misinformation, disinformation, and facts?
Yeah, definitely. Yeah, so I know that a lot of us, especially people our age, spend a lot of time on TikTok and Instagram and consume most of our information about vaccines and the pandemic through those kinds of mediums. I just want to emphasize that consuming information off the internet does not replace discussing with your with a medical professional about a vaccine or consulting from scientific organizations such as the World Health Organization, the CDC, the Department of Health and Human Services, the California Department of Public Health, or your own doctor, which I would say are probably one of the most trusted places to get information about the vaccine. There's also vaccines.gov, which is a very centralized resource for you to find any information about vaccines. It also has some FAQs that can answer any concerns that you might have. So I just wanted to sort of lay out those resources, first of all, as places where I find myself getting more information, even though I do spend a lot of my time on social media platforms. Yeah, I also wanted to emphasize, where not to get this kind of information. A lot of partisan sources or biased news sources, for example, oftentimes they accompany misinformation with charged language that's usually written to elicit some sort of reaction from the audience, whereas facts and data tends to be laid out way more simply. So that's one technique that I usually use to discern between misinformation and truth or fact, is that you'll notice that the language that accompanies misinformation is a lot more charged or can be very easily discerned as very biased. You can always double check information that you see online with trusted scientific agencies to make sure that what you're reading is accurate. So I definitely also recommend vetting what you read online with additional sources. And you're probably wondering, why would you trust these groups? What makes them different from what you see online? But just a reminder that these groups, such as the CDC, the content that they put out is very heavily researched and approved by subject matter experts across multiple different disciplines, including physicians, epidemiologists, researchers, and subject matter experts that are very, very good at their job and have vetted the information iteratively and many different times. And as young people, we know how to fact check and get the right information, but many older people might not know how to do that. They readily consume whatever they see online. So I would also encourage pointing them towards these kinds of sources and explaining why they might feel a little bit of discomfort based on what they see on social media. But yeah.
All right, thank you so much, Sanvi. And Ashens, in your community, what barriers in your community do you think people have when accessing vaccines?
Yeah, so I live here in Fresno and we see struggle with accessibility exhibited in a variety of different ways. One of the ones that's most visible to me as a young person who relies on public transportation here in the city is vaccine clinics. We aren't seeing mobile vaccines in neighborhoods like we used to. You can't find vaccines in your neighborhood park like you were in the beginning of the pandemic. along those lines, actual clinics here in Fresno are very sparse and far between. And for someone who doesn't have access to a car, having to actually look and search for a place to get vaccinated is super discouraging. Looking at South Fresno, you can see the number of vaccines decline in comparison to the north side. Coincidentally, also the red line of Fresno. On top of that, our rural communities don't have clinics, don't have CVSs. If you don't have a car, you have one bus, one chance to try to get the vaccine. And if you don't feel motivated to do so already, you're not going to go through all that trouble. We're trying to fix that with Vaccinate 58. We're trying to get into our South Fresno communities. We're trying to open up community events with vaccine clinics, getting vaccines to rural areas like Kerman, Fowler, Mendota. The pandemic still isn't over, and our unincorporated communities should be allowed healthcare. Our communities are facing barriers, and we need to acknowledge them and fix them. And that's what we're doing. Thank you.
Thank you, Ashton. And finally, Ani, what is the best way to approach a parent if they want to get vaccinated but they are vaccine hesitant?
The best way to do that is by having open conversations with your parents, like I said, and also hearing them out, right? Going to your pediatrician, making a list with your parents and being like, what are some of the things that are concerning them? And going to your pediatrician and talking to them. Why does this concern you? What is the information behind it? There's also so much amazing information on the VA 58 campaign that talks about, has Q&A questions that you parents can do. And also what I did was I did updated statistics every week through a presentation. And that really helped my mom be able to kind of have focus of how many people are getting vaccinated, how much research has went into this, and what the side effects really do look like. But we had multiple conversations with my pediatrician and other family members who had already gotten vaccinated. So another great thing is if you have a friend who got vaccinated, having them and their parents talk to you and your parents can be really helpful, because especially if it's a parent that your parents are close with and they have spoken to before and trust, having them explain why they decided to get their kids vaccinated can be really, really helpful.
Ani, I did bring up the 353 document. Did you still want to walk through this?
Yeah, I'm more than happy to go through the 353 method. Again, it's so important to have open conversations with your family members about getting vaccinated, especially if you're a teen and you want to get yourself vaccinated. So here are some amazing tips that VA 58 put together on how to talk to them. So a really important thing is about listening, listening to the other side and making clear your focus is their safety and your safety, especially if you're talking about why they should get vaccinated. I also had to convince my parents to get vaccinated because I was worried about them as well. And finding common goals, right? What we want for both of each other is, the best, right? Like we all want the best, even if it means that we have different ideas of what is the best. So making sure that we have that understanding that we're just trying to help one another. The key message is that the vaccine will keep you safe. Side effects are common, and you can obviously talk about the side effects with them. And also before you get the shot, ask the person who's providing it to you, like, what are some of the common side effects people will get? That the vaccines are very effective. And there's a lot of data showing that people who do get vaccinated have a higher chance of being safe from COVID-19 and not ending up hospitalized. The vaccine is built on research that has been done for over 20 years. And if you have questions, that you should ask, because that open communication is the most clear part. Being able to answer those questions and answer other people's worries is the most important part. And ending the conversation by acknowledging their personal choice. We can't force people to do things, and keeping communication open. So if they don't want to get vaccinated right now, they could have the chance to get vaccinated, after that, right? So having multiple conversations with them and just knowing that they can always reach out to you if they have more questions, and offering help to find a vaccine. Making a plan is the biggest incentive. If you don't make a plan with them, then it is far more likely that they will just forget about it and not get vaccinated. But if you make a plan with a vaccine clinic for them to show up that day, what time they're going to show up, it can be really helpful and make all the difference. Now I'm going to pass it off to my colleague, Sanvi.
Yeah, I just wanted to jump on right at the end real quick and just also add on one thing that really helped me with some of my relatives who are also vaccine hesitant was pointing out where their discomfort pertaining to the vaccine might be coming from. The first place for me that I saw was that what I noticed was that COVID has been very, very polarized and also traumatic for a lot of people. And many people have felt very uncomfortable going to mass clinics and getting shots. It feels unnatural because we're very used to going to vaccines in doctors' offices with extensive consultation beforehand and sitting down, whereas going to these massive clinics just feels very, very unreal. So I think it's important also just to remind them that it's still the same thing, even though the setting might be different. Vaccines are still safe, and that this different setting doesn't make the COVID shot less safe. And the second thing that I also noticed that my relatives were consuming a lot, especially because like they were always just like reposting things on social media without checking where they were coming from, was that while rare, adverse reactions do make a lot of noise on social media, which is why they might seem more often than they actually, might seem that they occur way more often than they actually do occur. So I think it's important to recognize that most of what circulates on social media is written to capture your attention, and just because it's written to be believable doesn't mean that it's actually reflective of the of the process of getting a vaccine and how successful it actually is. So just also reminding like my family members to back up what they see with data that's actually disseminated by trusted groups, I think also help them out a lot. But yeah, thank you so much.
All right, thank you to all of our wonderful panelists for answering those questions. And now we would like to turn it over to the audience for some poll questions. So, all right, so yeah, the first question: do you feel COVID-19 vaccines are accessible in your communities? The polls will be up for 2 minutes, by the way.
It actually looks like we're getting a lot of answers in, so I think I'm going to leave it open for about 10 more seconds.
All right. All right, so I guess we'll keep it open for a little while longer in case others can't see it.
I think we're good to move on to the next question now.
All right, and so the next question: what has prevented you or others in your community from receiving the COVID-19 vaccine?
All right, I'll leave it open for just a little bit longer. And sorry, I tried to launch the results of the last poll, but I'm being told that they weren't available. So I'll try and launch them this time. Sorry about that.
All right, thank you to everyone who answered this poll question. And we have one more poll question. So, where do you receive most of your COVID-19 vaccine information from? Yeah, and check all of that apply.
All right, just a couple more seconds and then I'll close it.
All right, so thank you to everyone who answered all the poll questions. And now we will hand it over to audience questions. So in the chat, just ask your questions, and we can go from there.
Arin, want to hand it over to you? Do you want to start with some of the questions that we have?
Yeah. So the first question, so for Dr. Chen, the updated booster has been approved for ages 5 and up. So what does the recommended vaccine schedule look like?
Great, thanks for asking. So the schedule is posted on the CDC website as well as a state website. And basically anyone who's 12 years old or older, the booster is available to be received 2 months after your last dose of your primary series. So for most adults, if you're not immunocompromised, you're healthy, it would be a 2-dose series of either an mRNA vaccine or the Novavax vaccine. And then 2 months later, you could get the what they call the bivalent or the updated booster. Just make sure, and I can post on the chat a nice little graphic. I tend to be more visuals, so I'll try to post in the the link to a graphic. It's geared towards providers or doctors or nurse practitioners or other practitioners, but it might be helpful for others to be able to visualize it. So I'll put that in the chat. Okay, I'll pass it back to Arin.
All right, we did get a question in the chat, but I cannot speak Spanish, so if someone can,
She's asking if anybody can translate for her.
I think that maybe this is something we take into consideration for a future panel. I think that's wonderful feedback, and I think it would be a really good opportunity for us to consider hosting a future panel in Spanish or with live translations. Absolutely.
yeah, I think that's a really good idea. So, is this panel available in Spanish? I think we could translate it probably. Uh, so yeah, but thank you so much for the positive feedback. All right, then moving on to our next question. So, once again for Dr. Chen, why do vaccinated people still get sick with COVID?
Sure, that's a great question. So there's several reasons. So vaccines are number one, when they study vaccine effectiveness, it's not 100%. So there will be a percentage of people who can still get infection even if they have received the vaccine. What has been shown is that when you get your vaccine, there's also primary series and after boosters, there is a period of time of sort of maximum immunity where the vaccine effectiveness is at the highest, and then immunity can be lowered over time, and that's called waning. And then if you get another booster shot, the immunity can come back up and help protect you again. One of the main reasons to get a vaccine is not only to hopefully prevent you from getting infection, but if you do get infection, it has been shown to be very effective. The vaccine effectiveness is very high, 80 to 90 upwards percent of preventing severe infection, hospitalization, and death. And so that's really a key point about getting the vaccine, is that you may get sick, but hopefully it'll be more like a cold and you'll recover quickly and you won't progress to end up being in the hospital. So while you still may get infection, you would hopefully not get severe consequences from it. I think that hopefully answers the question. Pass it back to Arin.
All right, thank you, Dr. Chen. And another common piece of misinformation is that COVID-19 vaccines lead to reproductive complications and abnormalities. So, what is the best way to address this source of misinformation?
Sure. So there have been, I would call them rumors, about the effects of COVID vaccine on fertility. There have been studies on this and the CDC actually has a website which summarizes and points out to studies that have shown that this hasn't been borne out, that persons who have received the vaccine, men and women, have gone on to have babies and be able to, and women have gone on to be able to have children and get pregnant. There may be some of those who say, well, is this going to be an effect in the far future? And as far as we can tell, that also has not been borne out. But again, the vaccine is 2 years old, so we have a vigorous safety and adverse event system to track and follow the potential for any side effects down the line, but so far the studies have not shown this to be true. The other thing that I wanted to highlight, although that's not particularly the question, is that those who are women who are pregnant, it is highly recommended to get the vaccine as well. It's a side issue about infertility, that these are women who are already pregnant. And the reason being is that the two reasons. One is if you are pregnant and you are not vaccinated and you do get the infection, you are at higher risk of having complications from that pregnancy. It can affect the fetus, the baby, and it can also affect the mom. And there have been maternal and fetal deaths for those pregnant persons who have gotten infections. So that's number one reason for pregnant women to get the vaccine. And the number two reason is that there are many studies that have shown that pregnant women who get the vaccine, they build up antibodies that are passed to the baby. And so that when after the baby is born, the newborn is actually protected against COVID infection and the severe consequences of COVID infection in case they do get exposed. As you may or may not be aware, the vaccine is approved for 6 months and older. So newborns are not in that group to be able to get the COVID-19 vaccine. So they would get their immunity from their mom while mom is pregnant with them. So just wanted to highlight that important group of persons who should be receiving vaccine. I can put a couple of links to the sites that I was mentioning about showing studies that there's no effect on, or there hasn't been shown any effect of fertility, and also about the pregnancy, pregnant person should be getting the vaccine. I'll pass it back to Arin. Give me a little chance to put the websites on the chat.
Wonderful. Thank you, Dr. Chen. And Arin, just want to point your attention to the chat. We have a couple of questions that popped up in there for the youth.
All right, yeah, so from Nicole, what is something positive that that you have experience working with other youth in regards to the COVID-19 vaccine? So any one of our youth panelists can take this one away.
One thing that I feel has really benefited me was actually being able to kind of share my story on the vaccine. And find other youth who have also experienced the same thing as me. It's kind of a traumatic situation to have your family, call you so many things because you decided to, get healthcare. And it really sucks, but to bring your story out, to tell people, not just young people, but also, people in power, it's really nice to be able to talk about it. Just because we want it to be fixed, we want things to these kinds of ideas not to exist anymore, and to spread correct information instead of misinformation.
All right. Does anyone else want to give their own answer to the question?
Yeah, I agree with Ashens. It can be very validating to talk to other youth and hear that your family is not the only ones experiencing these fears, that, it provides a sort of empathy for people who are more scared of the vaccine, because my first instinct is to get upset. This is my health that we're talking about. This is the people around me's health that we're talking about. There's all the information available to you in the world, and you choose to look at misinformation and not sort of filter those things out. But understanding that more than just my family is experiencing this type of fear, and it's almost kind of predatory the way that misinformation is shared to people in our communities. So to know that my family is not the only one going through those things, it's nice and hopeful. So, yeah.
All right. And for Dr. Chen, a question from Daniel. What type of COVID-19 antiviral treatments are available right now?
Oh, I was just typing in the chat. I was going to answer that because I didn't know if there were other questions. So there is, thanks for that question. I'm a vaccine expert, but I can tell you, I can tell you what I know about treatment. So what I'm aware is that there are two treatments that are available as an outpatient, meaning like you're not hospitalized. One is a pill. It's called Paxlovid. It's available to those persons who are infected, but just keep in mind, these are not cures. These are just to help lessen your symptoms and prevent you from ending up with severe disease and ending up in the hospital. It should be started within the first 5 days of your illness. And then similarly, there's another medication called remdesivir, which is an IV treatment. This one's a little bit more difficult to provide, as it's an what we call an infusion. So you have to go into a facility, and it's and you have to get it 3 days in a row. So you have to go there 3 days in a row. Again, same thing. It's not a cure. It is meant to help lessen your symptoms and shorten your illness period, and has sort of a limited time period of when it's effective. So you have to be provided it sooner than later. I will pass it back to Arin.
All right. We are coming up on time, but so we should finish this up. But we have a few more questions that we can get through. So there is a concern that circulates among COVID-19 vaccines causing myocarditis or inflammation of the heart in children. Is this true?
Oh, is this me?
Yeah.
Oh, okay. Sorry. The question was about myocarditis.
Yeah.
Okay. So myocarditis is inflammation of the heart. There have been a lot of review of the vaccine, which has shown that certain age groups may have a higher risk of potentially getting myocarditis. It's males, young men and adolescents. It may occur usually after the second dose. It's a very rare occurrence. If it does happen, it tends to be very temporary, and no one has died from myocarditis from having gotten it from vaccine. On the other hand, if you're not vaccinated and you do get COVID-19, your risk of getting myocarditis is actually higher from being sick and being infected, and you could potentially die from COVID-19 versus getting a vaccine. And that's my answer.
All right. Yeah. So then there will be one more question that we will do. So finally, Dr. Chen. So due to the uncertainty surrounding new mRNA technologies, numerous individuals also believe that the COVID-19 vaccine can permanently modify your DNA. So what is the best way to combat this source of misinformation?
The mRNA technology has been studied for a long time. Someone mentioned 20 years. I think that's probably about right. It's just there haven't been any mRNA vaccines approved until COVID-19 using this technology. So mRNA is messenger RNA. Basically, it's just a little piece of protein. It's triggering. It's asking your body messaging to your body to produce proteins to protect you. It's not DNA. It's not going to invade your genes or your DNA material. It's a little piece of protein that's a message. So that's basically what it is. And how do you combat that? Misinformation. I can give you a website to review and refer to for those who have those misconceptions.
Wonderful. Thank you so much for everyone who's been awesome about answering questions. Want to move in quickly to our call to action, as we do have a follow-up event coming up on Saturday. Arin, I'll pass it over to you.
All right. Yeah. So yeah. All right, so thank you all so much for actually participating, and we want to have a follow-up discussion this Saturday, December the 10th, and we need your help in bringing family and community members to attend. So we have some final poll questions, and we would like you to answer them. All right, so the first question, do you plan to ask a family or community member to attend the Saturday, December 10th event with you? All right, thank you to everyone who answered this question. And we have another poll question coming right up. All right, so how many family or community members are you able to bring to this Saturday's virtual event? Right. Thank you all again for your participation in today's event. We truly appreciate your time and the discussion. We hope it was useful to you, and we look forward to seeing you and your family and friends on Saturday at 2 p.m. for the Family Educational Workshop. From all of us, bye for now.